Here on Hello Kuwait, and we have with us right now Dr. Niranjan Kumar, and Dr. Niranjan is an ophthalmologist specializing in retinal disease. Dr. Kumar, welcome to our program Hello Kuwait.
Thank you so much.
Nice to have you with us this evening right here on the program. We know you have a very busy schedule. We appreciate your time, and
Thank you so much.
you know, diabetes is very prevalent.
Thank you for the invitation. Thank you.
It's our pleasure. Thank you very much. And diabetes is very prevalent right here in the state of Kuwait, and for that matter all around the world. And tell us about the eye problems associated with diabetes, please, doctor.
Yeah, there are many problems because of diabetes. Primarily it involves small blood vessels in the retina. We call microangiopathy, if I can speak technical term. So basically damages blood vessels of the retina that might bleed, might leak, ultimately causing a loss of vision. So if we detect early, if we screen early, then we can manage in a better way these diseases. Other problems, like sometimes they might have more chance for having a cataract, more chance for having high eye pressure.
Is that all because the vessels become smaller?
They become leaky.
Okay.
Yeah, they are not like healthy blood vessels, so they become leaky. So that is the reason.
Okay.
Yeah.
So what can people do to avoid this?
First and foremost is to control diabetes and other problems like high blood pressure, high cholesterol, those things. So they should eat well, control their sugar, and they should get eye checked up regularly. That is the main thing that they should
When
do.
you say regularly, how do you mean, like every 6 months or?
Yeah, that depends. Like when a person is diagnosed as having diabetes, so immediately he should get his eye checked up that time. So those having type 2 diabetes, non-insulin dependent diabetes, so they should get it checked up immediately. Those having insulin dependent, so they have little bit leeway, that maybe 5 years or so they can wait, but better to have checked up
regular checkup, at least yearly, right?
Yeah, once like they get it checked up, then depends on the condition of the retina.
Sure.
So if they do not have diabetes, then still once in a year annual checkup they should do. And if they have some problem in the retina, that after that eye doctor will tell that how frequent it should be checked.
Retinal detachment it can be quite common with people with diabetes, right?
Yeah, there are many types of detachments.
Tell us about that in detail, please.
Yeah, one type of detachment is called tractional detachment. So here in diabetes, what happens that because of we know that blood vessels are diseased, so they cause some fibrosis. In Arabic they call talayuf. So because of fibrosis, retina gets pulled up. So once they get pulled up, then they cause detachment of retina. But there are other types of detachment of retina, like such as there is hole in the retina, so that causes other type of detachment. And sometimes there are some underlying problem in the retina, so they cause exudative type of detachment. But here in diabetes we have tractional retinal detachment.
Okay.
Yeah.
So now, what are some of the treatments for this, doctor? Are they all operations?
No, not all. Not all. Like it depends which stage disease is. Like in early stage, there may be some leakage in the retina, so we might do laser therapy for that, or we can give injection in the eye. So depends that what condition is. Sometimes they have too much blood in the retina. So
and you just withdraw that then?
Yeah, we do a surgery called vitrectomy surgery. So we make a port in the eye, and through their probe cutter, with that we suck out the blood from the eye. And the same way, if there is a detachment, then we remove fibrosis and we put retina back in its place.
Okay.
Yeah.
These are some important techniques that you do, especially for people with diabetes. And of course, November 14th is International World Diabetes Day.
Yeah.
So it's good to touch on these topics, because diabetes does affect not just the eyes; it affects actually the whole body.
Yeah, that's
so,
right.
So important, and it does affect the eyes in people who, as you said at the top of our interview, do not take care or maintain their diabetes correctly. So that can really disturb the vision and the eyesight. So, so is there any other, let's say, new kinds of modes of treatment for these issues instead of because I know some people when they have diabetes they take like these shots regularly for the eyes. Tell us about that.
Yeah. So if there is leakage in the blood, we call maculopathy.
What is that?
That means central part of the retina, they become diseased. There are exudates, there is fat in that. So for that we need to give injection regularly, maybe like monthly or so, depends on which type of injection we are giving. So there are many injection and one is called Avastin, other one
What
is
is
called
that? Another a
it's-
form of an injection?
Yeah. So one is Avastin, other one is Lucentis, and third one is Eylea. Sometimes we give steroid injection called Azardex. So these are the 4 main types of injection that we are giving. So depending on type of injection, frequency depends. Like Avastin we are giving regularly, Eylea maybe later on 6 to 8 weeks we are giving, and Azardex usually lasts 3 to 6 months. Once we give, it lasts 3 to 6 months. So depending on type of injection, depending on eye condition, some people they get better after maybe 3-4 injection. So they
Will get better.
Yeah. So once eye gets stabilized, then we wait. If disease persists and keeps on improving, then we keep on giving injection.
So it's a myth then that these injections really don't make the eyes better. They just keep them at a level they're at?
Some people they get better.
They do?
Yeah.
Okay.
Yeah.
So now tell us a little bit more about your profession, doctor, because dealing with the retinal diseases, it's become more abundant of late, correct?
Yeah, that's right. So because of one is diabetes, that there's so many people having diabetes.
Yeah, the rate is always on the increase.
Yeah, so number of people having diabetes increasing. So eye problem also, retinal problem also getting, we are getting more cases. And injections, now we are giving monthly, so we have to check also monthly. So like that load is there, logistic point of view, but people are getting better, like they have better therapy, and awareness also getting better, like more people are aware now, so they are able to control their blood sugar level in a better way. So everything depends on control of systemic condition, that means blood sugar, blood pressure, cholesterol, all those things.
So what are some general tips or advice for the audience watching, how, even if they don't have diabetes, just to better take care of their eyes?
One is that regular checkup, that after 40 we say that you should go to an ophthalmologist to check that your eye pressure is okay, retina is okay, and eat well so that you can live well, like eating a lot of leafy vegetables,
Yes,
fruits.
tell us about that. What
yeah.
Is there a special diet or certain foods that are helping with the eyesight?
Moderate living, like nothing should be extreme. So it's not that people
so everything in moderation.
Yeah. So it's not that people should not eat a particular food or eat particular food, but moderation, more of like leafy vegetable, fruits, those things.
What about now some of the younger people? Are they also affected by retinal disease?
Yeah, they are
It is,
affected.
huh?
They are affected.
Tell us about that, sir.
Yeah, like younger people now they have more diabetes. So once they have more diabetes, so they will have more problem in the eyes also, especially the retinal problem. So they have, and in younger people sometimes it's very aggressive disease, like they progress very fast, it's difficult to treat them. So better to prevent the problem. So if they are aware, they get their eyes checked up regularly, they control their systemic condition, then hopefully they will have longer eyesight, beautiful world to see around.
How can parents detect if there's something wrong? If they have their youth, some children, some eye problems, how can they detect that?
They have to get it checked up, like a good
Parents
thing.
Can't really tell, they just have to do a checkup.
Yeah, like we put drops in the eye to get pupil dilated, and once it's dilated, then with this special machine we check that everything is okay inside the eye.
Okay, and you recommend that people should do that, especially if they have diabetes, correct?
Yeah, that's right.
Okay.
Yeah.
Any other bit of advice that you have for our audience watching this evening right here on Hala Kuwait, doctor?
So first and foremost, as I told, that regular checkup, live moderately, and get eye checked up. That is main thing.
Those are the main things, huh?
Yeah.
And what about now floaters? What is that exactly?
Yeah, some people, especially elderly people, they have black spot in front of eye.
Okay.
So if
What
they
is
have,
that?
if like we have vitreous gel inside the eye,
Sure.
sometimes they get liquefied. So once it gets liquefied, it causes floaters. So once they have this problem, acute problem, then they should get eye checked up, because they might have hole in the retina. If that is the case, then we have to do laser. If we delay it, then they will have detachment of retina, that needs big surgery. So they should get it checked up. On the internet, sometimes we have something called floaterectomy or vitrectomy for floaters. So some people are doing that, but majority of surgeons, they are still not in favor of doing that, because it might cause other problem in the eyes.
Okay.
Yeah.
Are there any other new diseases that are affecting the eyesight? that you would like to talk about, doctor?
Other problem, though less in Kuwait, is macular degeneration, especially like as longevity is increasing, people are living longer, so they might have in the central part of retina, they might have a degeneration. So if they have that, then they have a difficulty in reading vision. So difficulty in reading and doing near work. So that is important to check too, because now elderly population is there. So in that condition also we have to check with the special instrument, and if we detect in time, then we can treat. Like here also we give shot in the eye, say monthly shots in the eye, and maybe like in the early stage we might give vitamins for that.
All right, well that's great to hear, doctor, and we appreciate your time with us this evening right here on Hala Kuwait. And towards the end of our interview tonight, do you have any last words or comments for the audience watching tonight's episode, doctor?
Yeah, as I started the same thing, that live moderate life, active life, eat well, get your eye checked up regularly.
Good to hear that. Thank you so much, doctor, for being our guest.
Pleasure
we appreciate
to be here.
Your time.
Thank you so much.
We'd like to thank Dr. Kumar, who's an ophthalmologist specializing in retinal disease, for being our guest this evening right here on Hala Kuwait. Right now we're going to move on to another one of our